Hello, I'm Dr. John Milne, the CEO of Optum Surgical, here today with Dr. John Velyvis, who's the Chief Surgical Officer, board-certified orthopedic surgeon, fellowship trained in joint replacement surgery, and the founder of the Robotic Knee Institute. We're here to talk to you a little bit about the advantages of partial knee resurfacing, and specifically robotic-assisted resurfacing, and how it might be an advantage to your patients who are symptomatic with knee osteoarthritis. So, Dr. Velyvis, you want to talk a little bit about how knee arthritis affects patients that you see in your practice that are referred to you by primary care physicians?
A lot of people still have a lot of horror stories associated with total knee replacement. A lot of patients are told that they are too young to have total knee replacements, and sometimes they're even told they're too old to have total knee replacements. Patients oftentimes have a lot of fear about getting a total knee replacement. The partial knee replacement is not a new technique. It's quite old. It's been around for decades, but most surgeons haven't offered this technique to very many people because it's a very difficult procedure to get done right, especially done by eyeball or the traditional way. Undercorrection, overcorrection, implant sizing problems have led to devastating results on the partial knee side. So especially for younger and active patients, we really haven't offered this very often. Now we have a new technique, the robotic-assisted partial knee replacement, which offers unparalleled accuracy and precision of placement of these implants. Using a precision bone mill, we create a precision pocket in the bone, and we only remove the worn-out portion of the knee and resurface it. The partial knee preserves the crucial ACL and PCL, and the recovery is much faster. There's a lot less bleeding. In fact, these are all done outpatient. Return to work is dramatically improved. Return to function is faster and more full. I have no activity restrictions whatsoever after a partial knee. Patients have reported going back to golf, tennis, skiing, things that they hadn't done in 20 years or more sometimes. I even have one patient who is doing powerlifting in a Masters Olympic event after bilateral knee resurfacing.
So as you can see, this provides your patients potentially with dramatic improvements in their quality of life and their level of activity in comparison to, obviously, with a diseased knee, but also in comparison to what they would have had with a total knee. So tell us about what are the types of patients in terms of the age range and the disease state that is really appropriate, and what's the prime group of patients for whom this procedure could really benefit?
Almost everyone who needs knee replacement surgery has one side or another of the knee that is more effective. So for the really elderly patient who really isn't a good candidate for a total knee replacement, we can resurface just one side of the knee and do a quick recovery partial knee replacement on the robot and do it accurately and well and have them recover much faster. But my favorite patient population is the younger patient population, the 45 to 65-year-old patient who's been told by their primary care doctor or even their orthopedic surgeon that they're too young to have a knee replacement. With the partial knee done accurately, these are going to last really, really long time, and in fact we now have 2-year data with the robot showing 3 orders of magnitude less revisions and early failures at the 2-year mark with the robot because of the accuracy. With the better implant materials and the better placement on the robot, these should last 30 to 40 years. So patients who are in their 40s and 50s can now have a procedure that might be temporizing before they need a total knee in their 60s or 70s, or if it's done really well, they might even last the rest of their life.
And so the other piece is, as we look at the long-term health benefits of being able to do this, earlier intervention when it's early to mid-stage osteoarthritis of the knee, before the knee is totally degraded, we're able to allow patients to be up and active and continue to manage issues like diabetes and hypertension and prevent coronary artery disease in ways that we might not have otherwise with traditional treatments such as steroid injections or anti-inflammatories.
Right. We know these things work for a while, but they tend to work less and less with time. And we're looking at the overall health benefit for each patient over time. And so instead of limping around and telling patients that they shouldn't have surgery, we now have a really accurate partial knee resurfacing for the most common form of arthritis, which is at the knee. And we want to get these patients back to activity, to weight loss, to prevent obesity, and get their health status at a premium for their age at a much younger stage so that they can maintain their health and make your job easier as a primary care doctor.
Tell us a little bit about the Pro-Knee Institute and the types of things that you do and why it's important for a patient to be looking at a high-volume center such as yours.
Right, so we've done over 500 of these robotic-assisted partial knee resurfacings with a high level of success unheard of in my total knee practice. And the more you do, the better you get at them. The robot is an expensive tool. Not every community offers this surgery. And with Optum Surgical, we are now able to have a cost-effective way of caring for your patient and returning them back to you with this novel technology that is much better the more you do. And so we do the most, and we do them well and accurately, and we have a great program from start to finish, from leaving their home to returning to the patient back to their home and back to your care.
So as you can see, we are excited about being able to offer this technology to your patients and be able to help you provide better care to your patients and improve their overall health outcome. We invite you to learn more about this technology. If you'd like to speak with either one of us, feel free to contact us through Optum Surgical. You can visit us at our website, www.optumsurgical.com, or visit Dr. Velyvis at the Pro-Knee Institute here in San Francisco.